Today's question is, a 2.5-year-old male child was brought to the pediatrician with history of swelling in the testes since 1 month. The child was referred for an opinion from a surgeon. The surgeon ordered a panel of blood investigations in which AFP levels were raised, alpha fetoprotein levels were raised. The tumor was excised and the biopsy showed the following. What's your diagnosis? So this is what the biopsy has showed. Any guess what it is? And these are the options: granular cell tumor, teratoma, seminoma, yolk sac tumor. So now, even if you don't know anything, you don't have no clue about what the histopathology image is showing, you can still diagnose this condition because of the age. You have a child with a young age, okay? So less than 3 years, okay? And another important clue is alpha fetoprotein levels are raised. So if you just look into the options, which among these can cause elevation of alpha fetoprotein to a significant level? You should think in that terms. Even teratoma can cause, teratoma can have a multiple component. You can ectoderm, endoderm, but what causes a significant raise in AFP levels and what could be an appropriate answer? Now then go back to the histopathology image and just think whether you have heard about anything like this or have you ever seen it. So what is shown here? In the center you can see a blood vessel which is containing RBC and which is surrounded by 2 layers of cells, okay? So does it resemble like anything else? So what is this? This is called Schiller dual bodies. So what do you mean by Schiller dual bodies? So Schiller dual body is nothing but you have a central mesodermal origin of a capillary surrounded by 2 layers of cells. So this resembles glomerulus. So it resembles glomeruli of a kidney, okay? So this is seen in case of yolk sac tumor. So remember, yolk sac tumor is a tumor which occurs predominantly in children less than 3 years of age. You can have Schiller dual bodies and it can be associated with marked raise in levels of alpha fetoprotein. Remember, Y is the last alphabet, A is the first alphabet. Like that you can remember, like little opposite. So alpha fetoprotein levels can be raised in yolk sac tumor. So yolk sac tumor is a germ cell tumor of the testis. Okay, so what you should know, what else do you know about yolk sac tumor? So what is, sometimes yolk sac tumor can occur in a pre-pubertal age group or a post-pubertal age group. So what happens if it is pre-pubertal and what happens if it is post-pubertal? So if it's going to be pre-pubertal, it usually of a young age. So if it's of a post-pubertal, occurs in a little older age group. So in pre-pubertal age, it could be a pure yolk sac tumor. That is, only yolk sac component will be present. Whereas if it's a post-pubertal, it can be a part of mixed germ cell tumor. So your yolk sac tumor can be coexistent with other tumors like your embryonal carcinoma. One more thing is, post-pubertal is associated with germ cell neoplasia in situ. Okay, so when you take your seminiferous tubules, you can have your lining epithelium which is dysplastic. That we call it as a intratubular germ cell neoplasia in situ. So that's like a precursor lesion to a germ cell tumor. So that is usually associated with post-pubertal, whereas pre-pubertal can arise de novo without any pre-existing intratubular germ cell neoplasia in situ. Okay, so that's the difference between pre-pubertal and post-pubertal. And one more thing is, they can have some eosinophilic globules. These are called hyaline globules. This was a question in a central institute exam 2 years back. You can have hyaline globules. Hyaline globules are seen in yolk sac tumor. And what is this hyaline globule contain? They have alpha fetoprotein and alpha 1 antitrypsin. So this is about yolk sac tumor. What about granulosa cell tumor? So granulosa cell tumor will have coffee bean shaped nuclei. They have grooved nuclei, and this again has something called Call-Exner bodies. What is Call-Exner bodies? So they resemble like a glandular structure. So you can see an empty space which is containing a pink material, acidophilic material, surrounded by bean-shaped cells, coffee bean-shaped nuclei with grooves. So this is called Call-Exner bodies. Call-Exner bodies are seen in granulosa cell tumor, and granulosa cell tumors are positive for an IHC marker called inhibin. Thank you.